Good morning from WKYT News. I'm Bill Bryant. We welcome you to Kentucky Newsmakers. Later we'll be hearing from Kentucky Education Association President Eddie Campbell. But first, Kentucky's Health Commissioner Dr. Stephen Stack is joining us. As we head into spring, there are measles cases in parts of the country, at least one confirmed case in Kentucky. It has been a really tough flu season, and Kentucky has seen three pediatric flu deaths. The Kentucky legislature is in session. Lawmakers have decided to regulate retailers who sell vaping products. Kentucky water plants will no longer have to add fluoride to the water if a bill that has passed through the House gets through the Senate. Kentucky recently observed the 5-year anniversary of COVID, and the commissioner is no doubt watching some changes coming down from Washington. Commissioner Stack, thank you so much for being with us. We appreciate it.
Thanks, Bill. It's good to be here.
We'll run through some things here. First of all, the measles outbreak in Texas and New Mexico and some other states has been really attention-getting, but it really got our attention when there was a case here in Kentucky. How concerned are you? How concerned should we be about measles?
Well, if we're here in Kentucky, the individual who had measles got it when they traveled internationally. We're now at about 3 weeks after the time we announced it. And so at least for that particular exposure here in Kentucky, hopefully we're on the safe side now, and hopefully we won't have any more cases. The general public should not fear measles because we are still overwhelmingly vaccinated. If you've had 2 doses of immunization, you're 97% protected from even getting the disease. The measles vaccine is one of the most effective vaccines we've ever made. The problem is fewer people are getting vaccinated, and these risks of big outbreaks are increasing like we're seeing in Texas.
Is that the MMR vaccine that most took?
That's correct. So it's the measles, mumps, rubella vaccine, and it's a 2-dose vaccine. Most children get it at about age of 1 year, and then a second dose at age 6.
All right, so if you're an adult, how do you know if you did get it as a child?
Well, so here's the thing. If you're 70 years of age or older, if you have had at least 1 dose of the vaccine, or if you have ever served in the United States Armed Forces, you are pretty much presumed to be covered and should not have to worry about the measles. If you are under 70 and don't know or can't prove if you've gotten a vaccine, there's no harm if you go out and get another dose. Your primary care provider or a pharmacy can probably help you with that. Okay,
that was something that a lot of folks have wondered, could they get it again? All right, this was a very tough flu season, Dr. Stack. Hospitals have been packed. You've also reported 3 confirmed pediatric deaths. Do we know why this flu season was such a challenge?
No, we always have cycles, and there are times that the flu season is very bad and other times it's not. The virus changes every year. Influenza mutates a lot. Sometimes it's more contagious or more dangerous than other times. And so this was probably the worst influenza season we've had in 15 or 16 years. It peaked for us probably in early February, and now for the last 4 weeks, cases have been going down.
So some encouragement that we're toward the end of that season.
Right. So flu season goes officially through the end of April. But it would look like at this point we are on the tapering side of it, and the risk will further reduce.
The nation and Kentucky recently marked the 5-year anniversary of COVID. Those early days were very challenging, as we all remember, and certainly you remember, as you were so in the middle of that at the time. The pandemic was declared over in 2023. How manageable is COVID now?
And so COVID is clearly considered endemic now, meaning it's freely circulating. It's with us here to stay forever, most likely. COVID is still more dangerous than influenza. We still announced almost 900 deaths last year from COVID in Kentucky. So it's still a big deal. But because most people have either been infected and or have been vaccinated, the risk to the general public is much lower. I still would urge everybody to consider getting a fall booster shot when they come out each year. And definitely if you're 60 or older, or if you have any major medical problems, you should most certainly get at least 1 booster a year, because that clearly reduces your risk of going in the hospital, which is where most people end up dying.
You look back, 5 years seems in some ways like a long time ago, and in other ways, obviously, we all remember exactly what we were doing at that time and the challenges that we had during that year and a half or so.
Yeah, it's been one heck of a road, Bill, and we all lived through it together. But like the governor said, we would all get through it, and we all did get through it together. The things that I most remember are not the difficult times. It's how we came together as a state. And I say this repeatedly, because I think Kentuckians need to hear this. I mean, we came together and treated each other with kindness, caring, and compassion. And we showed that when we do those things, that we can overcome a great deal. People watched our daily briefings from around the country and even some international destinations because we really strive to give people concrete, factual information to say what we knew, what we didn't, and what we would be doing to learn and fill in the gaps for the things we didn't know. Bill, I think Team Kentucky did a great job coming together, and particularly when we continue to have societal challenges and strife where we disagree with each other. I want to continue to urge us all to find those things we have in common, because when we see each other and treat each other with dignity and respect, we really do go a lot further and have a better journey.
Were you surprised at how political things got during that time regarding the vaccine and other measures that were taken at that time?
Yes and no. I mean, it's unfortunate it became so political so quickly, but I missed the days in a way of being able to tell at the press conferences about my history stories and the things that prior human experience have shown us. It became difficult in 1918 with the global influenza epidemic then. People don't like having their lives disrupted. People don't like living in fear of diseases and things like that. That's human. That's fundamentally human, and that is not going to change. So it was always going to be a point in time when we found it difficult to hold together. But Bill, I focus much more. We really did rally together as a state for a very long time. And I think we should feel very good about that in Kentucky, that we were able to come together as a community.
If it happens again, Dr. Stack, could we do it again? Could we come together?
Sadly, Bill, I'm concerned that we're in a worse place now, because people are still fatigued from having gone through such an enormous, difficult time. And unfortunately, there is propagation of misinformation and disinformation that has further eroded people's confidence in the medical guidance they're being given, further eroded people's confidence in immunizations and proven therapies. We have got to, Bill, emphasize that science has really gotten us to a much better place. The measles vaccine, for example, 2 doses has virtually no risk to anybody, and yet it is 97% effective of totally preventing the disease. We have to make sure that the public and parents know this, so it's a safe way to protect your children, instead of other things that clearly have no proven benefit and could end up in people having really serious illness, and unfortunately, in the worst extreme of the tragedy, dying from these diseases.
As the days get longer and the sunshine is out there with us and all of that, our thoughts turn to spring and spring break, and then, of course, the summer months to come. Safety becomes a paramount issue, and that also is within the scope of your responsibilities to ensure that Kentuckians consider some things when they're outside and involved in activities.
Right. So I'll take the lead, and then I'm going to distort your question. So
okay.
As we enter the warm weather months, wearing sunscreen is really important, particularly if you have a haircut like mine. This is a great opportunity to get cancer.
That's
and
you
don't want to get
a nice haircut.
If you don't want to get skin cancer, so sunscreen on exposed skin is really, really important to lower your risk of getting skin cancer. The other thing, though, Bill, this is a great chance for me to mention the Our Healthy Kentucky Home campaign. So we're doing a year-long campaign, and you can go to our website at ourhealthykyhome.ky.gov, and you can find this month us talking about cancer screening and prevention. Last month, we talked about emergency preparedness for what people should do to try to be prepared when we enter tornado season and have problems like that. So, Bill, as the weather gets better and people can be active and outdoors, I'd say let's do those 3 things that the Our Healthy Kentucky campaign is urging people to do all year long. That's eat at least 2 servings of fruits and vegetables every day. It's be active and exercise at least 3 times per week for 30 minutes, and to be socially engaged and stay connected. So a great way to do this, Bill, would be to have a fresh salad and cook something on the grill as a family, and then go for a walk together, and you get all 3 in one couple hours span.
All right, a good prescription there. As we watch the legislative session, there's a bill that would heavily regulate retailers who sell vaping products, treating it more like tobacco and alcohol. Are you supportive of that change?
So we're definitely supportive that no one under 21 should be buying these things. We'd urge no one to use these products because nicotine is addictive, and all of these things bring with them other potential negative health consequences, such as increased risk of cancer and other problems. So we are very supportive of anything that will help us to limit the uptake of vaping and the uptake of use of tobacco products. And so we look forward to seeing these efforts hopefully yield fruit and further lower our smoking and vaping rate in the state.
It's unclear if this will become law, but there is another bill that would allow operators of local water plants to decide whether to put fluoride in water. Should that decision be shifted to the local governments in your view?
Well, the politicians will decide whether it will or won't or should or shouldn't. I personally urge us not to do that. Kentucky has some of the, unfortunately, worst oral health in the entire country. And we know that when you put the fluoride in the water at the very low doses that we do and you monitor it properly, it lowers by perhaps 25% your risk of dental cavities and dental disease. This is really important, Bill, because people who have poor oral health, poor teeth, and missing most of their teeth find it more difficult to succeed in life. There's lots of evidence that people with poor teeth have it harder to navigate life, get better jobs. And if we want to help people to advance in life and get good jobs and be self-sufficient and thrive, we really need to ensure that they are able to be healthy all around. And that includes oral health. And in our state, that means fluoridating the water is really helpful. And to remove it from the general municipal water supplies would really set Kentuckians back, I believe, and make things worse for too many of our citizens.
Dr. Stack, as you watch Washington, President Trump has made lots of changes and cuts. Are there areas that you are very closely watching that you may have some concerns about?
Well, I just want to emphasize just how important it is that we have a community of medical and public and science health professionals who can openly share information and collaborate. We all do better when we do that. I think our partnerships with global and international partners, our partnerships at the federal level through the CDC and in state and local health departments, those are really, really important. So I would urge policymakers at the federal level to invest in and support the Centers for Disease Control, to reconsider and invest in our relationships through organizations like the World Health Organization. Without this information and share of information, we run the very real risk that a disease as vicious as Ebola or a cousin of it, Marburg virus, that those things could get into our country, come into a major city like New York or Dallas or Miami, and could run rampant through a city and cause horrific harms. So, Bill, I really would urge them to not retreat from their commitment to support public health and the sharing of actionable, scientifically based evidence that will help ensure our Kentuckians and our Americans can take steps to keep themselves healthy and well.
Final question, a few seconds left. Lexington reports opioid overdoses are down. Hundreds of overdoses have been reversed by the use of naloxone, which they point out is available from local health departments. Are you encouraged by that trend and the ongoing effort to get a handle on Kentucky's drug problem?
I am encouraged. One death is one death too many for the opioid overdose. And unfortunately, we've had far more than just one death. The naloxone distribution has really helped to save lives. Our efforts in harm reduction programs around the country, around the state through local health departments has really helped to save lives and get people into treatment and hopefully recovery.
Dr. Stack, thank you so much for giving us a few minutes. We appreciate it very much.
Thanks, Bill. Happy spring to you.
Same to you. Thank you. And stay with us, everybody. We're coming back with Eddie Campbell, the president of the Kentucky Education Association. It's next on Kentucky Newsmakers. Welcome back to Kentucky Newsmakers from WKYT. The seas are shifting in education. Kentucky's Education Commissioner has expressed concerns about huge job cuts at the U.S. Department of Education. The Kentucky legislature wants to ban phones in classrooms, and districts continue to look for teachers right now. And do schools need more NTI days after the tough winter we just had? Kentucky's Education Association President Eddie Campbell is watching the trends and advocating for teachers and staffers in schools, and about to wrap up his term. You've had a good tenure, right? It's been a good run.
It's been a good run.
A challenge,
and it's been a challenging 6 years. Let's say that.
A lot has happened. Mr. Campbell, President Trump wants to eliminate the U.S. Department of Education. Certainly has made major cuts there, and send that money then to the states and make that their responsibility. What are your concerns, and what would the KEA want to ensure happens if the decisions are then made at the state level?
You know, Bill, It should be concern for everyone. Every parent in the state of Kentucky, every educator in the state of Kentucky. You know, the U.S. Department of Education provides a lot of resources to the state of Kentucky. $1 billion comes into our state from federal funding, through title funding, through funding for food programs through the U.S. Department of Ag. We want to make sure that those programs continue and make sure those services continue. The Department of Ed does a whole lot to make sure that we're supporting our schools. Those title dollars that come in, especially in our rural districts, help to hire additional educators, help to provide training for our educators through those dollars that come in.
What would be your concern, though, if the federal government just wrote a check for $1 billion to Kentucky and said, now use it for education?
Well, we have to make sure that that money is going where it needs to go. And right now, that's what the U.S. Department of Education does. It has a real good oversight of making sure that those dollars go to the students that need that dollars the most. We talk about our special needs students, or students with learning disability or need special learning help. Those dollars help to provide that support, but it also makes sure that those students are getting those services. There's a lot of oversight that goes into making sure that those students have their IEPs, those IEPs are being met, and that there's trained educators that are right there beside that student supporting them every step of the way.
So you would say that framework of rules for the money and how the programs are implemented is important, that it come from Washington?
Oh yes, I think it's vitally important. And it's not just funding that comes into the school districts. We're talking about making sure that those get approved in a timely manner, that those services are being met, that we're making sure that the rights of our students to get a free and appropriate public education is happening in every single school district, not just here in Kentucky, but all across the nation. There's 50 million students across the nation that are supported by the U.S. Department of Education. There are thousands of school districts that are supported. So making sure that we have supports that are coming from the federal level that help our schools, especially in our rural areas of the state, but most importantly, that are helping our students. When we start cutting at the U.S. federal level, at the Department of Education, we're hurting students. That's where the hurts are going to
But again, could it be that it would end up better if money comes to Kentucky and the Kentucky Department of Education would then be able to allocate money as it sees fit? Or do you get concerned that the legislature begins to make rules and change where some of the money would go?
Right, and that's some of the concern. When the U.S. Department of Ed sends the money down, there's lots of oversight and there's lots of support that goes with that. Our Kentucky Department of Education does a phenomenal job supporting our local school districts. They have highly skilled and highly trained individuals there that are out there helping support, and I have no doubt that they will continue to do that. But making sure that our students' rights, those civil rights that come that are being met, especially when we have students with disabilities, making sure those needs, because none of the federal laws that dictate public education and what a student should receive, none of those are going away, and there has to be oversight in that.
All right. Many schools, we'll be watching that, and I know you will. All right. Many schools have used up their NTI days, and with this tough winter that we've had, and lawmakers are figuring out whether or how to provide more. Most teachers, of course, want to be in the classroom. Obviously, the lawmakers would rather them be in the classroom because they hear from the parents who want the kids in the classroom. But in some cases, it is not possible. So, is more NTI the answer, or do they go into June as we did back in our day?
Well, exactly right. And the NTI Day issue is very complex. There's lots of bills flying around, some to get rid of them altogether, some to provide more. Every school district right now gets 10 NTI days that they can utilize throughout the year, especially when we have bad weather. Being from Whitley County, Mud Creek, that road gets a little dangerous when you're driving up there. Stinking Creek when we're driving up there. It's an opportunity and a tool for educators to continue the education during those bad weather times. So sometimes we have to think about what's best for the students, making sure that they're safe, making sure that their education is continuing. So, I think a lot of our school districts really utilize those NTI days to make sure that they continue. They don't use them all at one time. It's not like our school districts saying, oh, we're going to do the next 10 days NTI because it's snowing. They do to make sure that they're reviewing, they're keeping the educational process going for our students. It also gives an opportunity for our educators to keep a check on their students to make sure that they're doing okay.
One of the debates seems to have been whether you just do this because this is a tough winter, an emergency situation, or you relax those rules permanently and give 10 extra days or whatever, and that's part of the debate.
That's part of the debate right now. We've had a hard winter. We had the incident on I-75 that closed school districts. We had the flooding in eastern Kentucky where several of our schools got flooded and they were out for a couple of weeks. So making sure that our school districts have that option so that students get the full benefit of their educational opportunities.
The legislature has passed bills aimed at classrooms, including banning phones at school in those classrooms. Do teachers generally applaud that mood? Is it hard for them to compete with the phone?
It has been hard, and I hear that a lot from our educators. And it has become a growing issue. I think our educators are appreciative of making for having some rules around cell phone use and during instructional time. We see studies that show that students where they have put these in place, where they have bans of phones during instructional time, students pay more attention, they're engaged more in their classrooms. I actually was talking to an educator just the other day where they have a ban, and the number of books that were being checked out in the library had gone up exponentially. The other part of that is, there's a lot of concern around mental health and social media. So part of the bill that's being considered right now addresses that issue also, and making sure that our students have good mental health supports and also focusing in their classroom. And we see that students are paying attention more, achievement goes up. So we have lots of research to show that when we take that away, well, not take it away, when we put some guardrails around it, it really gives the students and educators an opportunity to really learn at a high level.
KEA has continued to push for across-the-board raises for teachers. The legislature did not want to get into the budget this year. There is a session coming up next year in which they could consider that, but they have wanted to let that be a local decision. Is pay keeping up in a way that is going to help address this shortage of teachers out there?
So you're right. We still have an educator shortage, not just here in the state of Kentucky, but all across the nation. But we're not keeping up with educator pay. We're still 44th in the nation when it comes to the average teacher salary. We're 48th in the nation when it comes to our support professional salaries. Those are the people who drive our buses, who cook the meals, who are the aides in our classrooms, or the secretaries who let people in and welcome people into the schools every day. We have to address that issue. This session was a great opportunity to really take that minimum salary schedule that the state has for educators in the state and look at it and adjust it so that they could work on the budget next year so that everybody moves up. I know they want it to be a local decision, and a lot of our districts are taking up that mantle. We have advocated for a first-year $50,000 starting salary that would move all the educators forward. So we have to address that issue. If we're going to recruit and retain high-quality educators to be in our public school classrooms, right now is the time for us to do that.
Mr. Campbell, and you're about to wrap up your time in this position. You have been a career educator. In the few seconds we have left, what case do you make to young people that teaching is still a great career?
It's the most rewarding career in the world. You get to work with the future of the Commonwealth. We have amazing educators that are in classrooms right now. We have future educators that are sitting in classrooms, and I encourage kids to think about the career of education. It is the most rewarding career that you can ever do, because not only are you changing the lives of individuals every single day, you are changing the future of the Commonwealth when you're a teacher, when you're working with a student. And I don't want to just limit it to teachers. I want to talk about all educators, whether whether you're a bus driver, if you're a food service, you're having an impact on a student every single day. And that's important because our public schools fling open the doors every day. They welcome kids with open arms. They support them because they want them to be the best that they can possibly be. And that's what educators do. So,
Eddie Campbell, thank you for coming from the KEA. We appreciate it.
thank you so much, Bill. I appreciate it, and congratulations to you on your
thank you.
honor with the legislature.
We'll have a little word about that here in just a second, okay? Thanks. We'll come back and wrap up Kentucky Newsmakers in a moment.
And now therefore be it resolved by the Senate of the General Assembly of the Commonwealth of Kentucky, the Senate does hereby recognize and congratulate Bill Bryant on the occasion of his 40th year of service with WKYT TV as he continues a distinguished career of professional journalism.
Let's this body show Mr. Bryant our gratitude and appreciation for his service and recognition.
I promise you that a producer wanted to put that in at the end of this show, but I very much do appreciate that honor, certainly from Senator Thomas, and the remarks also made by Senator Mays Bledsoe on the floor. It was a bipartisan event, and being fair and getting it right have always been my guideposts. On Kentucky Newsmakers next week, we have scheduled State Auditor Allison Ball and also the Senate President Robert Stivers talking about the session that is concluding. That is Kentucky Newsmakers for this week. We appreciate you being along, and we hope you make it a good week ahead.